Welcome to Pharmacology Further podcast. And today we're going to talk about the Pharmacology Further e-newsletter January 25. First of all, we're going to talk about the Is Pharmacology Difficult section. Under that, we're going to talk about the FDA approved drugs for January 25. So let's begin with the first one. Dadopotamab deruxtecan DLNK. The brand name is Datroway. It is lyophilized powder for injection. It was approved on January 17, 2025 by FDA. It's a TROP2 directed antibody and topoisomerase inhibitor conjugate for the treatment of hormone receptor positive human epidermal growth factor receptor 2, that is capital HER2 negative breast cancer. The second one on my list is triosulfan. The brand name is Grapefax. It is a lyophilized powder for injection. It was approved on January 21, 2025 for stem cell transplant conditioning. It is an alkylating agent to be used in combination with fludarabine in adults as well as the pediatric patients of 1 year of age and also older people with acute myeloid leukemia, that is capital AML. It is also used for myelodysplastic syndrome, that is capital MDS. The next drug on my list is tocilizumab NO. The brand name is Aftosma. This is an injection. It was approved on January 24. It's an interleukin 6 receptor antagonist, that is IL-6 antagonist. It is biosimilar to Actemra. It is used for the treatment of rheumatoid arthritis, giant cell arthritis, polyarticular juvenile idiopathic arthritis, systemic juvenile idiopathic arthritis. The next drug on my list is meloxicam and rizatriptan. The brand name is Simbravo, and these are the combined drug tablets. They were approved on January 30, 2025. It's a non-steroidal anti-inflammatory drug and triptan combination to be used for the treatment of migraine with or without aura in adults. And the last drug on my list is suzetrigine. The brand name is Jurnox. These are the tablets. They were approved on January 30, 2025. It's a sodium channel blocker to be used for the treatment of moderate to severe acute pain in adults. Next, we're going to talk about the latest medical updates. The first one on my list is the latest study from a renowned medical journal, capital BMJ. It states that using contemporary hormonal contraceptives on regular basis, they increase the risk of ischemic stroke. The next latest research from a renowned journal, Annals of Clinical and Translational Neurology, it states that women who suffer from epilepsy generally bear offspring with decreased bone metabolism. One of the studies done by Harvard University states that employees in the United States suffer quite a lot with chronic health ailments, and this adversely affects their work lives and also the productivity. Next, a recent study from capital JMA JAMA Network Open states that young people inclined towards nicotine and tobacco use, they often suffer from related attention deficit hyperactivity disorder, that is also famously abbreviated as capital ADHD. The next one, current research from American Heart Association states that infection-related hospitalization, that is abbreviated as capital IRH, it is linked to heart failure with reduced ejection fraction. These all latest updates, they are taken from the best possible internet sites, and they are the latest research done in January around that time of creating this particular newsletter, and they are borrowed from the one of the most trusted and the wonderful sites from internet. Now we have next from my classroom section. Here I will be sharing some insights of pharmacology learnings from the classes that I have taken this month or any special topics that I have read in the particular subject. So my own reading topic comprises of influenza and its treatment. Let's talk about it. Flu. Influenza is a respiratory illness that one gets from influenza virus. Symptoms include fever, head and body aches, coughing, stuffy, runny nose. One should be vaccinated every year to avoid the complications. People with asthma, COPD, lung diseases, they are at more risk. Influenza A, B, C, capital ABC, they are the most common types of viruses affecting people. Some of common names of the viruses are capital H1N1, swine flu, and also the bird flu virus. Influenza is a contagious disease. It spreads from direct or indirect contact. No swab test is the test for influenza. Antivirals help a lot to cure early and shorten the sickness time. Antiviral medications. These are basically oseltamivir, zanamivir, peramivir, baloxavir, marboxil. The side effects of these medicines may include nausea, diarrhea, and bronchospasm. One should take plenty of rest, stay hydrated, and can take non-steroidal anti-inflammatory drugs to relieve the fever, head, and body ache. Cough suppressants, that is antitussives and expectorants, can calm the cough also. Preventive measures include getting vaccinated yearly. One can wear mask, avoid sharing utensils. And the problem can last from few days to 2 weeks. That's all in Is Pharmacology Difficult section of my e-newsletter, Pharmacology Further. Now we're going to talk and jump over to the next section, that is Radgin Wiz. So today we're going to talk about what is your story. From Radgin Wiz writing desk, I want to talk about a travelogue writing. I recently visited Mahakumbh 2025 in Prayagraj, Uttar Pradesh. I'm deeply impressed and motivated to write a travelogue about my visit and experience. Here are a few tips to write an influential travelogue. First of all, do your research nicely. Write descriptively, highlight the various attractions. Give all the details of vehicles, etc. to reach the destination. Their types, charges, etc. Also mention different types of hotels, stay rooms, etc. for stay along with their charges. Mention the common rare places of tourist attractions. Explain the traditional heritage and cultural richness of the particular place. Give a detailed list of do's and don'ts at the place and also the important points to be cautious about. That's how you can write an effective and impressive travelogue. Let's go to our next section, Simple and Sparkling. In the Simple and Sparkling section, we talk about nutritious advice, and today we're gonna talk about bay leaf. Bay leaf is green more than a spice. It comes from the bay tree. In Latin, the tree is known as Laurus nobilis. The tree is commonly found in Mediterranean region. Chemicals in bay leaf help people to control blood sugar and cholesterol levels. It is observed, though not yet thoroughly proved. Bay leaves are used much in pickling, marinating, and stewing, etc. Essential oil component mainly is cineol. It adds low calories to foods, boosts the fiber, vitamins, minerals, and antioxidants. Bay leaves contain good amount of vitamin A, vitamin B6, and also vitamin C. They are also rich in iron and manganese. They can be added to vegetables, curries, as tea. They can be added to soups. They can ease bouts of upset stomach. Tea is quite aromatic and it can relieve the sinus or the runny nose. Now let's go to our very interesting section, most awaited one, of the cough talks. Today we're going to talk about the essence of self-pampering. I'm sure everybody loves self-pampering and they do so whenever they find an opportunity to do so. So, self-pampering, they are intentional acts of self-care which makes one feel rejuvenated, relaxed, and ready for one's goals after episodes of stress, hard work, etc. Some common acts are massage, spa, reading book, playing game, going out to eat, spending time with kids, going to cinema, etc. These activities reduce stress, improve the mood and the self-esteem also. Such acts of self-kindness increase relaxation and improve quality of life. Some good examples are listening to music, taking a facial, getting your nails done, taking a walk in natural surroundings in a beautiful garden, shopping, cooking, baking, etc. It is not a selfish act, so don't feel guilty about it. Don't feel that you are a selfish person. One and everyone deserves it. It is an investment in physical, mental, and emotional well-being. It relieves from pressures of daily life and lessens anxiety. It is well said, take time to love yourself. You deserve it. Well, that's all from my end in the spectacularly curated combo of January 25 issue. Hope it satisfies your quest for information and medical updates and news. Greet you all in the next issue, which is on its way. That's what I would say. Please spread the word and subscribe to my channel. It would be a great motivation to all my efforts in curating this wonderful e-newsletter. Pharmacology Further e-newsletter. A step further pharmacology. That's all for this issue and that's all for this particular episode. Thank you. Take care. Bye-bye.